Hello friends, Sarah here from the Centre for Mental Health. I hope everybody's well this week and you haven't been blown away. Sorry that the film is late today. Public transport sadly wasn't my friend, but I'm here now, and this week we're going to talk about social media. You might have seen that on Wednesday we published a briefing about social media, mental health and children and young people. Rather controversially, we have said that more research is needed before we can be really clear about what the risks are with social media. We don't think that the debate about social media at the moment is helpful. So we had a quick scan of the evidence, and what we found was that the evidence is not robust enough yet. And perhaps the evidence that we do have is skewed towards a much more negative picture and image of social media. What we do know is that social media can be addictive. And we know that with any addiction, there are side effects: poor sleeping, poor self-esteem, loss of relationships. And certainly I know and have seen and spoken to people who feel that they are addicted to social media, that everything they do is related to the social media platform that gives them the most attention. What we know is that addiction can be treated, and there are services around the country being developed to look at social media addiction for sure. We also know that another risk attached to social media is cyberbullying, and whilst again the research in this space is being kind of reviewed and explored in much more depth, we do know that many young people are very, very worried about their online presence. They are worried about, what people might say or think of them. And we do know that people do often feel able to say things online that they might not say to you face to face. We also know that there is unhelpful comparisons and competition. I certainly know for myself that, if I'm not feeling great and I see my friends or family on an exotic holiday, I do feel rather flat. I also know that there are times, and in my life certainly, where social media has absolutely replaced face-to-face social interaction. I'm an adult, so for a young person, I guess that could be probably quite risky and uncomfortable. But we also know that there are some emerging positive benefits to social media. We know that for some people it allows them to develop social capital, develop networks of new friends, people that really understand them, a real sense of ownership over their online presence, an ability to connect with things that they are interested in all over the world. That certainly is a huge benefit to many, and I am constantly impressed by young people who are developing their activist kind of personalities on social media, who've created global networks for massive change. Yesterday I was listening to an interview with a young woman who had developed an amazing campaign around period poverty, most of which had been developed online. We also know for some people that once you find your tribe on social media, it can be a great source of self-esteem. As a big woman, I know that when I looked on social media for people who looked like me, it was probably a fair amount of time before I found the body positivity movement. That made a great difference to me. And I know for many young people, being able to find people that look like them, that seem like them in other ways in terms of what they're interested in, also can be extraordinarily helpful. Whilst we also know that the internet is the source of a lot of very unhelpful information, we also know that there is great information on there. And Facebook and others are doing much to try and distill that information. And of course, fake news is still rife, and we have to be careful about what information is online. But we also know that for some people, social media and digital allows them to develop ways of finding help for themselves, finding links with people that might be able to share how they're feeling or tips about feeling better. So actually for some people, social media is the source of a great deal of support. So I guess if I was, I have 2 young children, And I'm very, very clear about how they access online resources. And for sure, when they're of an age where they'll be accessing social media, because I don't believe social media is going anywhere, I shall be telling them about safe ways of using social media. Things like, you know, finding your tribe, finding, you know, groups and people who reflect what's important to you. Giving them the resilience and the tools to be able to turn off when things are bad. To be able to interact online safely and helpfully, not to mindlessly scroll, because, you know, you're a passive recipient of information and images perhaps. Whereas when you're engaging, I guess that you're more in control of what's happening. It's a minefield perhaps, but we do have to enable our young people to develop the skills to kind of manage social media, to make it work for them, to create a force for good. That might sound utopian. But of course, we all have to take responsibility for how we engage online. What information do we put online? What do we share? What information do we think is important, and how do we interact with others? It's always uncomfortable to me when I see graphic images of you know, animals being hurt online, and I think, you know, we need to think about the benefits of sharing images. So in terms of what we're calling for, we are calling for more research, and of course we would, we're a research organisation, but we're calling for more research that looks at not only the risks, but looks at the positive benefits, that enhances what we know about social media that can be used as a force for good. That we can start creating a balanced, more nuanced conversation between all of those that are important in terms of the future of social media and children and young people's mental health. We do want to stop the kind of binary conversations that we're having at the moment. We want people to come to the table. So our call to action really is to stop using words like blame. Social media didn't invent austerity. Social media did not invent the housing crisis. So I guess when we're thinking about children and young people's mental health, we've said it before, it is a complex set of factors. Social media is one part of that. And possibly it's so powerful, it can attend to all of the other parts too. Or in the very least, help individuals that need support in terms of housing, information around benefits, etc. Online counselling, for instance. But in order to do that, we have to get people around the table. Let's move from a position of defensiveness to a position of creativity and opportunity. And certainly in many places, those conversations are happening. So if you're like me and social media is incredibly important to you, remember the things that are helpful about social media. Pay attention to the times when you're on social media and things don't feel right. Block and turn off. Social media can be a force for good, but it does require some work. And what we're not saying is social media companies have a get out of jail free card here. They're absolutely responsible, but so are we. We'd be really, really interested to know what you think about social media and mental health. What tips can you give us so that we can share with our followers that allows you to use social media for your well-being? And also the things that don't help. So let us know, and we'll share that with all of our colleagues and friends. And I'll see you next week talking about something else, I'm sure. Thank you. Bye.